Digest Spotlight this morning, we have the Honorable Terrence Deyalsingh, Minister of Health, joining us to discuss the National Health Agenda. Good morning to you, Minister.
Morning, my friend. Morning. Good morning to all your viewers and wherever people are on your platforms. Good morning.
How are you doing this morning?
I can't complain, brother. I'm fine.
All right. So, I mean, for the last 10 years, you've been the Minister of Health, yeah?
Fortunately or unfortunately.
Whichever way you look at it. No, let me start by saying I appreciated the way that you were as transparent as could be, especially during the times of the COVID-19 pandemic, right? I think everybody got a lot more familiar with you, and we got to see you on a daily basis at some point. So I want to commend you and the team behind you, of course, the entire ministry, on that initiative. Let me start off there, right? Because I think that's one of the greatest things about your tenure so far. So tell me, what do you hold in regard in terms of some of the things that you would have achieved as Minister of Health that you're really proud of?
I think the proudest achievement was the reduction in maternal mortality rates, which we were supposed to achieve by 2030 according to the UN SDG, or Sustainable Development Goals. We started to hit those figures, not in 2030, because 2030 hasn't come, but in 2018.
Okay.
So we started to hit those figures where preventable maternal deaths could be largely avoided.
Mm-hmm.
So I think that's a very good achievement for Trinidad and Tobago. Allied with that, some other big achievements would have been the construction of hospitals, Point Fortin, Arima, Sangre Grande, and Central Block, which will take in its first patient in July. But what is more important is not just the physical structure, what is going on inside. And our major revolutionary intervention is the application of technology and AI into the systems now. And let me give you 3 examples. I am sure you or you know somebody, a mother, father, who would have had a CT scan or X-ray done somewhere. And then when you go to another hospital, they have to redo the X-ray, redo the CT, or walk with it. Those days are largely over now, because we have introduced a system where the doctors and nurses can view all your radiological images across the country.
And is this backdated? So, for example, if I had a X-ray or CT scan or MRI done 10 years ago or 5 years ago, would it still be in the system?
In most cases, yes. So we are backdating all those things now. But all your current radiological images, we can view it.
Okay.
We can now view your lab results, your blood works across the country. So we don't have to redraw blood, go to a lab again, have you wait in a second and third time. And that is major for a small country like Trinidad and Tobago, this introduction of technology. Thirdly, the introduction of e-prescriptions. So your doctor doesn't have to physically write out a prescription. He writes it out electronically, it goes down to the pharmacy. By the time you reach there, in most cases, your meds are waiting for you.
Okay.
So all these technological advancements is something that we have been driving over the past 2 years. And finally, one of the biggest complaints of the healthcare sector over the years, and why patients have to wait long in clinics, is lost files, these paper files.
Yes.
We are now digitizing those.
Okay.
We have digitized several thousands already, so that we are moving to a place by hopefully the end of this year where you have one patient, one record, one view across the country.
Okay.
Across the country.
Who's manning that system?
How you mean, who is manning it?
Because I mean the way technology works is that it's often going to need software upgrades. We're going to need people to stay on top of the maintenance of it. So is that under the ministry, or is that under the Ministry of Digitization?
No, so we are working closely with the Ministry of Digitization for advice, for hand-holding.
Okay.
But we have to manage it.
Right.
What they will be managing will be the cybersecurity aspects of it, because they manage all the cybersecurity for all government agencies.
Right.
So they manage the cybersecurity part. But on the front end, we are managing that, the actual patient interface and so on. And I think that application of technology, and now with AI, which we are introducing in Eric Williams and have introduced at St. James, will revolutionize the way doctors and nurses deliver healthcare to patients. So it's less paperwork. We're moving from paper heavy to paper light to eventually paperless.
Okay.
And that is the road we are on now. It's a very exciting time. I mean,
how have the doctors and nurses and generally the staff at the hospitals have been responding to it?
That is a strange thing. You always hear around the world when you are introducing technology that there is resistance.
Yeah.
Right? Especially with the more mature crowd who didn't grow up with tablets and phones and things. And you always hear that. But we took our time to engage them. We let them tell us. And then out of that engagement, they have adopted the thing.
Okay.
So they are just as enthusiastic as a young graduate from UWI who came out last week.
Okay.
I mean, there has been zero resistance.
But in terms of understanding the technology, so I understand the resistance and they might be willing to work with it. But in terms of efficiency and understanding how to use the technology efficiently, how has that part been
Once they use it twice, 3 times, and they see how efficient it is, they love it. Okay. When they see how it saves them time, it reduces errors, transcribing errors, they love it. Okay. Once you get accustomed to it after the first time, second time, and you know where to click, I mean, it's just phenomenal how technology now, in the past 2 years that we are driving, is transforming the way we deliver care and services to patients.
Now, I have to wonder though, Minister, in terms of the cost of that technology and implementing that technology and maintaining that technology, in terms of comparing it to the cost of what we would have had for storage before, what is the difference financially?
Well, I haven't really done compare apples with oranges as yet. But I'll tell you something. When you walk into a vault the size of this room, and you are faced with millions of pages of paper, and you want to find a patient file because a patient is waiting in a clinic, it's daunting.
Of course.
So it's not just monetary gain. It's patient-centered approach where you have one file, one patient, one view. And that redounds to the benefit of the patient eventually.
Now, using the technology as well, how do we implement the National Health Research Agenda? That part of it is very interesting to me because the research is always very important in order for us to move forward.
Yeah. So actually, Northwest is having their research day, I think, this week. So technology is infusing everything now. And Northwest's research agenda this week is going to be focused on adoption of AI.
Okay.
How can AI help us find new antibiotics? How can AI help us screen for cancers? AI right now is proven to be more accurate in reading mammograms to detect early breast cancer, as opposed to a radiologist looking at the scan using physical eyes. So all that is being infused now into the health agenda. And it is going to drive research more and more, discovery of new antibiotics, because we need new antibiotics because, as you may know, there's something called antibiotic resistance.
Yeah, when you build up a resistance after using it for however long.
Now AI is discovering new antibiotics, which we need because approximately 1 million people a year around the world die because the bacteria that they have, the infections, are resistant to common antibiotics. So AI is just driving the health agenda and driving it forward at lightning pace.
All right, so let's talk a bit about the National Strategic Plan for Non-Communicable Diseases. Because I know from 2017 to 2021, the ministry would have launched a National Strategic Plan for the prevention and control of non-communicable diseases. How has this plan been going, and how was it? Would you say it was effective?
Yeah. So we recently launched. So every 10 years, 5 to 10 years, you do something called a STEP survey, where you go out and you interview about 4,000 or 5,000 persons in the population to see how healthy they are. And that gives you a reasonable sample to judge the health of the population.
Okay.
The last one we did was in 2011. We repeated it last year. Basically, and we had a press conference on it, basically, the population's health as far as NCDs has been stabilized.
Okay.
So it means that we didn't get
worse.
We didn't get worse.
Right. But did we get better?
Well, I'll come into that. If we hadn't done the NCD program, we would have gotten worse.
Okay.
Did it get better? In some parameters, yes. In our hypertension clinics, we have more people with controlled blood pressure.
Okay.
We have about 40,000 persons with controlled blood pressure, which we never had before. With our diabetes clinics, more patients are better managed via what we call the HbA1c reading. That's a fancy term to say that your diabetes is under control.
Right.
I won't go into the details. We still have a problem with people not eating enough fruits and vegetables. But we are seeing more people exercising.
Right.
Right? So it's a bit of a mixed bag.
Yeah. What do you attribute these positive changes to?
I think the ministry and my personal pushing of the message. People seem to be drinking more water now and giving up Coke and Pepsi and Red Solo and all these things, which is good because these soft drinks have no nutritional value.
Right.
Right? And they just spike your sugars, causing diabetic problems leading to amputations and so on. And I think the ministry's pushing of that agenda is starting to bear fruit. But the NCD problem is 100 years old. It started back in the 1920s.
Yeah.
We are not going to solve it in 10 years. But we have stabilized the patient. We are seeing some positive results, but moving forward 2025, 2030, we need to have phase 2 of that now.
Which looks like what?
Well, the manifesto will come out to tell you what that will happen.
When the manifesto come in?
That is above my pay grade. Soon.
All right, let me get back into your pay grade, right? You mentioned earlier the reduction in neonatal mortality rate.
Yeah.
What do you think attributed to that reduction?
Again, you must have policy prescriptions, and I think one of the best things we did was setting up the Directorate of Women's Health.
Okay.
Headed by Dr. Terrence Deyalsingh. That drove the agenda in managing everything to do with women and neonates. Policies and having someone literally sit on them to make sure you not only have the policies, but the policies are actually put into action. Right? So that was key. That was a key intervention to get a department set up to do that.
Tell me, before we get into, I want to get into that a little bit, right? But I want to talk about some of those policies that you're talking about. Because I know it's not just the policy for the neonatal clinic.
Yeah.
But tell me about some of the policies that would have been developed during the last 10 years.
Okay, so how to deal with postpartum bleeding. One of the major causes of maternal mortality was bleeding after you gave birth.
Okay.
So how we deal with that? How do we stop that bleeding? One of the major causes of maternal mortality is hypertension and what you call preeclampsia or eclampsia. How do we deal with that? Those were the two major causes. How do we deal with diabetes and pregnancy? Because when a woman is diabetic, she tends to be overweight. The baby that is growing inside her tends to be larger. And when that baby is coming down the birth canal and gets stuck, that leads
C-section.
to emergency procedures could lead to death of both the
mother and the child.
The mother and child. So how do we deal with those issues? And the Directorate of Women's Health drove those policies, make sure our midwives and doctors and everybody were trained in both prevention at our prenatal clinics, but also how to deal with these emergencies during delivery and post-delivery.
But aside from the neonatal policies, I saw some policies coming out of the Ministry of Health and I find very interesting. For example, there's a policy on soliciting and receiving donations.
Yes.
Tell me a little bit more about that.
Yeah, so we have to be very careful how we receive external funding or external goods and services. Because very often people may want to give you something, but then they expect something in return. So we have to make sure
So that's
we have
how
a policy.
bartering works?
No, not in Ministry of Health.
Okay.
If you give us something, if you want to give us something, you have to sign that you expect nothing in return.
Okay.
It has to be done altruistically. I am giving you for the sake of giving you. So we have a strict policy on what the RHAs could receive and what the Ministry of Health could receive.
Okay.
So as not to compromise us.
And you also have a policy for the management of pesticides and toxic chemicals.
Yeah.
Tell me about that policy.
So we have to work closely with the Ministry of Agriculture to ensure that the nation's food supply is free from pesticides and toxic chemicals that are harmful to humans. So under Chemistry, Food and Drugs, we have a separate department, the Toxicology and Pesticide Control Department, that works with the Ministry of Agriculture. We vet what is coming in. We make sure these things are not carcinogenic, that, that is safe, that the residue left on fruits and vegetables aren't harmful to human health, and as minimally harmful to animal health
as possible,
insects and so on, because you don't want to destroy the ecosystem. So you have all these varied policies.
Yeah, and I know that, and people don't realize that a big part of your job is indeed policy making.
Yeah.
Because as the member for parliament and the minister in particular, policy drives the majority of what you do. Yeah. Tell me about the National Sexual and Reproductive Health Policy, because that was established back in 2020.
Yeah, so that came out of the Directorate of Women's Health again.
Okay.
How do we advise people to manage their pregnancies, reproductive health, to be healthy, to possibly help you plan your families too? Right? So all these things contribute to men and women partners making proper decisions as to their reproductive and sexual health, trying to get the rates of sexually transmitted diseases down, like syphilis and so on.
So in terms of the implementation of these policies, you would say that they have been implemented successfully across the board during your tenure?
By and large, yeah. yes.
So then you do have no worry for no Ministry of Implementation in the Ministry of Health?
No, the Ministry of Implementation is ready to drive projects, from what I understand, infrastructural projects, planning permissions, and so on. It's not to drive policies like this. Right?
All right. Tell me about the decentralization of mental health, because that's been a major accomplishment for you in the last 10 years as well.
Yeah. So you would recall, and David Rudder has a song, St. Anne's, St. Anne's, St. Anne's.
Yeah,
remember that song,
madness,
right?
Yeah.
So St. Anne's Hospital was seen as
the madhouse.
Well, not the madhouse, as the epicenter for where you send mad people.
Right.
And the stigma and discrimination of mental health is something we have to deal with. What happened with St. Anne's was that families would send their mentally challenged persons to St. Anne's and just leave them there for 30 years. It is inhumane. It is not right. All the modern science tells you that the best way to deal with some cases is in their communities, where they can work, where they have family support, and so on. That is what decentralization means. Moving away from this asylum-type treatment to a more community-based treatment. So when we built Point Fortin Hospital, Arima, Sangre Grande, New Central Block, we build them with psychiatric wards. So that those patients who are able to be treated in the community can be treated there, and reserve a mental institution like St. Anne's for those chronic long-stay patients. Not all mental patients need chronic long-stay institutionalization.
Yeah, but we definitely all need to be checking our mental health regularly to make sure that we are all as mentally healthy as we possibly can be.
Correct, my friend.
Minister, I want to thank you very much for joining us this morning.
You're most welcome.
Unfortunately, our time is up already.
Yes.
But I do want you to look into that camera and just give the nation a message on your way out now.
So we have SEA coming up soon, very soon, to all my constituents in St. Joseph and wherever you are. SEA is an interesting time. Be calm. You can only do your best at this time. And from me to all my SEA students and parents, much love.
Ladies and gentlemen, the Honorable Terrence Deyalsingh, Minister of Health, joining us inside the Now Morning Show. We take a